Welcome to this educational video on eosinophilic esophagitis, or EU. EU is a chronic, immune-mediated disease characterized by inflammation of the esophagus, the tube that carries food from your mouth to your stomach. In this video, we'll explore the causes, symptoms, diagnosis, and management of this increasingly recognized condition. The precise cause of EU isn't fully understood, but it's believed to be triggered by an allergic reaction to foods or environmental allergens. When susceptible individuals are exposed to these triggers, their immune system overacts, leading to the infiltration of eosinophils, a type of white blood cell, into the esophageal lining. Common food triggers include milk, eggs, wheat, soy, peanuts, tree nuts, and seafood. Environmental allergens like pollen molds and animal dander can also contribute to EU, although less commonly than food allergies. The presence of excessive eosinophils in the esophageal lining causes inflammation and damage. This inflammation can lead to esophageal narrowing, strictures, and the formation of rings. These structural changes impair the normal function of the esophagus, making it difficult for food to pass through smoothly. The impaired passage of food and inflammation is the primary reason for EU symptoms. EU is increasingly recognized globally, with prevalence rates varying geographically. It's estimated to affect approximately 1 in 2,000 people. EU is more common in males than females and is frequently diagnosed in children and young adults, although it can occur at any age. There also appears to be a genetic component to EU, as it often clusters in families. The symptoms of EU can vary depending on age. In infants and young children, symptoms may include feeding difficulties, vomiting, abdominal pain, and failure to thrive. Older children and adults may experience difficulty swallowing, also known as dysphagia, food impaction, which is when food gets stuck in the esophagus, chest pain, and heartburn that doesn't respond to traditional antacids. Some individuals may also experience upper abdominal pain or regurgitation of undigested food. Diagnosing EU requires a combination of clinical evaluation and diagnostic testing. The gold standard for diagnosis is an upper endoscopy, a procedure where a thin, flexible tube with a camera is inserted into the esophagus. During the endoscopy, biopsies are taken from the esophageal lining. A diagnosis of EU is typically made when there are 15 or more eosinophils per high-power field in the esophageal tissue. Allergy testing such as skin prick tests or blood tests may also be performed to identify potential food or environmental triggers. While specific classifications for EU aren't commonly used, there is ongoing research into endotypes or subtypes of EU based on genetic and molecular markers. This could lead to more personalized approaches to diagnosis and treatment in the future. The primary goals of EU treatment are to reduce inflammation, alleviate symptoms, and prevent long-term complications. Treatment options include dietary modifications, medications, and esophageal dilation. Dietary therapy involves eliminating trigger foods from the diet, either through empiric elimination diets or allergy-directed elimination. Medications, such as topical corticosteroids like swallowed fluticasone or budesonide, help to reduce inflammation in the esophagus. In cases of severe esophageal narrowing or strictures, esophageal dilation may be necessary to widen the esophagus and improve swallowing. More recently, biologic medications, such as dupilumab, have been approved for the treatment of EU. Currently, there is no known way to definitively prevent EU. However, identifying and avoiding known food or environmental triggers can help to reduce the frequency and severity of symptoms. Working closely with a healthcare provider and allergist can help to identify and manage potential triggers. The prognosis for individuals with EU is generally good with appropriate treatment and management. While EU is a chronic condition, symptoms can often be effectively controlled with dietary modifications, medications, or esophageal dilation. Ongoing research is focused on identifying new and more effective treatments, as well as gaining a better understanding of the underlying causes of EU. Recent advances include the development of new diagnostic tools and the investigation of novel therapeutic targets. Thank you for watching this video on eosinophilic esophagitis.